I'm a nursing student and I have realized something that might sound controversial, and that is nursing school doesn't truly teach you how to be a nurse.
Please don't get angry. This isn't an insult to nursing education. It's a reflection because there's a gap and we only notice it when we step into the hospital for the first time. I still remember my first day in the ward for clinical practice. Within the first hour, something settled in my chest, heavy and terrifying. I realized nursing school had taught me how to pass exams, how to memorize and aim for the perfect scores. But it hadn't taught me what to do when I faced real patients. Not one, but many. I knew anatomy. I studied drug classifications, pathology, and theories I supposed to know. But in front of patients, I froze. Because being a nurse isn't just about procedures. It's not only injections, wound care, or doing things correctly. Being a nurse is time management. It's communication, decision making, and it's emotional endurance. And we truly learn those things only when we are standing in front of a real person. When there is no textbook in your hands, no internet to search for the perfect answer, just a patient looking at you with hope, waiting for you to respond so they can feel safe.
People often imagine nursing school is like a simple path. You learn skills in the lab, you do it perfectly, you graduate, and then you become a nurse. But that is just wrong, because nursing is really messy and it's unpredictable.
Hospitals don't have unlimited time. Shifts don't pause because you're overwhelmed, and the day doesn't slow down just because you're still learning. That's why so many nursing students feel shocked in clinical practice. And it isn't just a personal feeling. There are studies that have reported concerns about the mismatch between what students learn in the classroom and what they face in real clinical settings. That mismatch can make students feel unsatisfied, even guilty. And I was there. Many of us don't know what to say to patients, especially when culture, language, and understanding are different. So we feel anxious before we even step into the hospital. And sometimes, students report being treated unfairly by the nurses in clinical settings, as if they forget they were students too. Once, some students aren't trusted by patients. Some aren't given a chance. And slowly, confidence breaks. But the hardest part, the part nursing school rarely prepares us for, is this. Nursing is not only physical work, it is also emotional work. As students, we don't just study signs and symptoms. We stand beside people at their worst. We witness pain, loneliness, and even death. And sometimes we face questions no textbook ever taught us how to answer.
What I mean is, imagine, what do you say when a patient says, "I'm afraid to die"?
You can't respond to that with memorization or with a perfect checklist. You can only answer with humanity. And the hardest part, you still have to keep going. You still have other patients, other tasks, other responsibilities. So it's normal for you to feel unprepared because nursing was never about being perfect. Nursing is about being human. It's about making decisions, setting priorities, and staying present. So, how do we close this gap? First, nursing students need learning that reflects reality, not only from textbooks and skills labs. More realistic simulations, more communication practice. One of the example is by become a volunteer. Become a volunteer in community health events, social organizations, or anything. Because when you volunteer, you learn how to talk to people in the real world, not in perfect clinical scenarios, not in skills lab, but in real conversations with real needs. And for nurses in hospitals, students need to be guided and treated like learners, not burdens. Give them chance and space to grow. And finally, to every nursing student watching this, it's okay if you feel unprepared. That doesn't mean you're failing. It means you're in transition. It means you're becoming. And one day, patient by patient, shift by shift, you won't just be a student learning nursing anymore. You'll be a nurse.